This boy of 18 years of age had a congenital issues from birth. The surgeon Dr. K. Balasubramaniam told that the disease is something unique, one in 1 crore. Good afternoon. I am Wing Commander Dilip Chaudhary, attendant of patient Mrutyunjay Panda. Mrutyunjay Panda belongs to Odisha in a remote area. This boy of 18 years of age had a congenital issues from birth. Lots of treatments had undertaken in these 18 years in Odisha and all the hospitals. The parents have visited most of the hospitals and they could not recover from the disease what he was suffering. Very frequently the patient used to suffer pneumonia, cough, cold, high fever, etc. So everyone was in panic because he was the only child of their family. Then when the things gone out of control, so they have gone to the hospital in Bhubaneswar. The doctor seen all these documents. Then he recommended that there could be a surgery requirement in the trachea issues. So I am recommending these things to Yashoda Samajigoda to undertake the surgery and the medical requirements. Dr. Visweswaran is there in Samajigoda Yashoda Hospital. Please meet him and he will guide you what to do. On 12th of April, they came here. Then on 13th we met Dr. Visweswaran. He has seen the boy and all the medical documents. Then he advised us to undertake all these pre-surgery investigations. Then there was a consultations with the surgery. All the pre-surgery consultations were taken, all the investigations were taken, and the reports suggest that there is a surgery requirement in the trachea, and also there is the surgeon Dr. K. Balasubramaniam told that the disease is something unique, one in 1 crore. He had taken his pen, he had done a lot of studies in the country as well as out of the country, in US also, to find out what could be the reason for these things. The total genesis of the things or the diagnosis of the disease they could find out was, it was H-type esophagus trachea fistula. So that they need to be removed. The pipe joining the esophagus and the trachea needs to be removed because it had a porous, it had a hole joining both the pipes. The operations was carried out on 18th. Post surgery, the patient has recovered exceedingly well. All the parameters of the medications were taken properly and the boy was getting wet in this process. The doctor very frequently checked all the abnormalities before and now, and he is very comfortable now to eat and to drink, to sleep, everything is normal now. After finalizations of all the post-surgery requirements, the review was carried out from the surgical department, the thoracic department, the pulmonologist here, Dr. Visweswaran and team, and the gastro team of Dr. Jayant. So finally they have checked everything, all these things becomes normal, and they have advised the patient can continue with the light diet and he can be discharged and can proceed back to Odisha. Thank you very much. Thank you, sir, for the team of doctors here, including the thoracic surgeons, including the gastro surgeon. And thank you, sir, Dr. Visweswaran and his team. Thank you, Visweswaran, sir, for helping us to recover from this disease what the boy was suffering. He is recovered from that and he is coming back to normal. Thank you, sir.
Hello friends, I am Dr. Vishweshwaran, currently working as a consultant interventional pulmonology and sleep medicine specialist at Yashoda Hospital, Samajigoda in Hyderabad. We had this boy who was referred to us all the way from Orissa, and he was suffering from a very, very rare condition which we refer to as a congenital tracheoesophageal fistula. So basically there was a abnormal communication between the foot pipe and the windpipe. So whenever the patient was taking the food, it used to enter into his windpipe, cause pneumonia, and he was suffering from the recurrent pneumonias for a very long period of time. At this point of time, the doctor referred the patient from Orissa for a complex surgery which we refer to as a surgical correction of tracheoesophageal fistula. This is one of the rarest of surgeries which are performed, and at our center it was performed effectively, and post surgery the patient had a complete closure of this tracheoesophageal fistula, and the defect which was there from the birth has been corrected. Now the patient is discharged in a very stable state, and he is able to do all his day-to-day activities routinely without any discomfort. So whenever we have any sort of these congenital deformities, many of these require surgical corrections, and we can offer a good quality of care for this patient if they are identified early and an appropriate treatment is initiated. Thank you.